Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is brought to you thanks to the contributions of colleagues and partners in Wisconsin and across the nation, with support from the Robert Wood Johnson Foundation. It is produced in collaboration with Healthy Places by Design, an organization that advances community-led action and proven strategies to ensure health and well-being for all. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Daejeop since time immemorial. Today, UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, Twitter, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. For your convenience, the QR code will also continue to be displayed for the remainder of this short video. Your facilitators today include our host, Erica Burrows-Girardi, with support from CHR&R Communications Specialist Colleen Wick and the Collaborative Learning Director from Healthy Places by Design, Joanne Lee.
Welcome to previewing the 2024 annual data release. Hi, my name is Erica Burrows-Girardi. Today we'll be sharing some exciting new ways for you to explore county data and new tools for your health improvement work. There are a few ways that you can track with us. First, we want you to ask questions. We will be sharing more guidance about how you can do that in a moment. And then later this week, you're going to receive a webinar resource page that will help you get more information with links so you can learn more. CHR&R's webinars reflect the values we hold as part of the University of Wisconsin Population Health Institute. Values of collaboration, integrity, excellence, innovation, inclusion, and courage. These are the values that we aim to model during the webinar, and we hope that you will too. With that, I'd like to introduce you to the team that will aid in your learning experience. Let's start with Joanne Lee with Healthy Places by Design. Hi, Joanne.
Hi, Erica. So excited to be here with you and your team today. This time of year is always exciting with the annual data release. And audience members, I just want to let you know that we invite you to join the conversation and engage with us during today's webinar. And there's two ways that you can engage. One is you can ask our panelists questions by using the Q&A box. You can post questions there anytime, and I will be in there to either answer your questions directly or we'll queue a few questions up for the live Q&A portion of our webinar. You will also be seeing in the Q&A box Michael Stevenson, who is co-director for CHR&R, and Christine Muganda, who is the data and analytics team leader. I'm so grateful that they'll be helping to answer some of the questions. With that, folks, there's a second way to engage with us today, and that is through the chat box. And I'm going to hand it over to Colleen Wick to explain that.
Thanks, Joanne. Hi, everybody. Really excited to be here today, too. Like Joanne said, I will meet you in the chat. So please use the chat to share knowledge or respond to questions we may ask you. We want to have you join us in making the chat a welcoming space by adhering to a few guidelines. Use the chat to share successes, lessons learned, relevant resources, and links. Please engage in a respectful dialogue. Our chat conversations, as you could probably tell already, tend to be very engaging. So if they are too distracting, simply just close out the chat window in Zoom. Also, please know that views expressed by participants are their own. They do not represent CHR&R or Healthy Places by Design. Again, if you have questions for the panelists, use the Q&A box, and I'm now going to pass it along to our technologist, James Lloyd.
Hi, everybody. Thank you, Colleen. I'm James, and I'm a technology coordinator for County Health Rankings and Roadmaps, and we want to make sure that your experience is technically the best that it can be. So if you do encounter any issues, it's best to reach me through the question and answer window, as Joanne mentioned, and we'll do what we can to make sure you can participate today. Erica, as Joanne also said, this is such an exciting time of year. I'm really looking forward to this conversation.
Oh, thank you so much. And thanks to the entire technology team, production team, I should say. I'm always mindful of the fact that we have people new to County Health Rankings and Roadmaps, or CHRNR, as you hear us call it, in every webinar. So I want to start by introducing ourselves. At CHRNR, we believe in a future where everyone has opportunities to be healthy and to thrive. There are many factors that impact how long and how well we live, from opportunities we have to access, let's say, fresh foods and safe places to play, to opportunities to participate in decision-making processes. The data resources in our annual release highlight some stark differences in health that stem from historical and current policies and practices. And our annual release lifts up strategies and solutions that communities can use to take action. Here to discuss what's new for 2024 are three of my colleagues. So please join me in welcoming CHRNR Co-Director Bethany Rogerson, Data Analyst Molly Burdine, and Evidence Analyst Jillian Giuliano. And we're going to start with Bethany. Welcome, Bethany.
Hi, Erica. Great to be here with you and everyone today.
Bethany, we have some exciting changes underway here at CHRNR. Let's start with a preview of our annual data release. Can you share a little bit more about what's in store this year?
Yeah, absolutely. I am thrilled to talk about all of the work that we have been doing here at CHRNR and some of the new things we'll be offering. So as you open today's session, you mentioned the Institute's values of innovation and courage, and I wanted to lift these up. We're committed to innovating the resources we provide and how we provide them. At CHRNR, we're leaning into these values by introducing a new approach and sharper tools to help understand how long and how well people are living in counties across the country. So what else is in store? This year, we're providing updated data to include the most recently available information on more than 80 measures. We're providing more detailed health data for racialized groups. I have to say, our website looks better than ever. We have a fresh new look. We have new data, new interactive features, and tools to improve health. And we've added new strategies to our What Works for Health database. So our hope is that with these changes, we are supporting an even stronger movement toward health and equity on both the local and national levels, so that everyone, every community has what they need to thrive.
I always get so excited when I think about 80 measures, Bethany. That's a lot of information for communities. And I'm so excited for this, as you put it, sharper tool. So you just mentioned every community having conditions to thrive. Tell us a little bit more about that. Like, what is CHR's latest thinking and work around what shapes health and equity?
Yeah, it's relatively well understood that social and economic conditions outside the doctor's office influence how long and how well we live. Conditions like safe and affordable housing or having a livable wage. And these are the conditions that shape health. Many of us know these as social determinants. But what shapes these determinants or conditions? What are the policies, the laws, the traditions that shape our society? And who decides which places get adequate resources for people to thrive? At CHRNR, we're committed to broadening this view of what shapes health and equity. And we're asking these questions, turning our attention to the forces that shape these conditions. whether a community has that access to safe and affordable housing or has access to those good paying jobs, for example. These are important to health, and they're shaped by power and structures. And so the structural determinants of health show up in those laws, policies, our beliefs, and our worldviews.
Yeah, that's right. And like you were saying, we're so used to hearing about the social determinants of we understand how that influences our health. But we're talking about structural determinants. So can you share a little bit more about the difference between the social determinants and structural determinants of health?
I think of structural determinants as the layer beneath social determinants. So the structural determinants create and maintain advantages for some and disadvantages for others. They can show up as written or unwritten rules in society. I mentioned laws and policies, and it could also be decisions about how resources are allocated or how public money is spent. We believe that to advance health and equity, we need to go beneath and beyond the social determinants, beyond decisions about affordable housing or employment, and look at how to shift that power, shift mindsets. That'll require us to get broad input so everyone can have a say in their future. So that brings me to our annual data release on this slide and our national findings report. This year, we are exploring the structural barriers to health and equity in our national findings report, focused on civic health, or the opportunities that people have to participate in their communities. So we're continuing the conversation from last year. In 2023, some may recall that we explored civic infrastructure and civic participation. In this year's report, we're focusing on ways to participate and get information to have a say in our communities. We know that when we work together, we can improve health for everyone.
Absolutely. And folks, you'll hear more about our national findings report later in the webinar. But Bethany, I know we wanted to draw attention to a change in how we approach providing county health data.
Yes, this year we are bringing you a new way to view a county's health. We're sharpening our tools based on feedback from the field, from you, and our reflections on more than a decade of work. So this new view replaces the rank that you've seen in the past. And I know people's ears are probably perking up here. Instead of seeing that you're ranked, say, 82nd healthiest county out of 83, you'll now see your county's health on a continuum and be able to determine where there are meaningful similarities or differences from one county to the next. This can help people working to improve the health of their counties to identify and connect with others that share similarities and challenges.
Yeah, this is really exciting. And I'm sure our audience is curious about what the changes will look like. So, can you give us a brief walkthrough of what the county health summaries will look like?
Sure. So on the next slide, what we're looking at here is our new county health outcome summary. Health outcomes are how long and how well we live in our communities. So this graphic indicates how a county fares relative to other counties in the state. It also allows us to see how counties in a state fare on a national continuum of health. And as I mentioned, this will replace the rank we've assigned counties in the past. So let's explore this a little bit more. We're looking here at Genesee County in Michigan, which is represented by the dot circled in purple. And Genesee County holds importance for me. This is a place where I have family, so I hold it near and dear to my heart. In this graphic, you're seeing health outcome data for the 83 counties that make up Michigan. Each dot represents one of those counties, and the dots are placed on a continuum from least healthy to healthiest in the country. This graphic shows us that Genesee County is faring worse than the average county in Michigan for health outcomes and worse than the average county in the US. The state and national averages are represented by those two vertical dotted lines you can see here.
And I really like this new view because we can it more accurately reflects the similarities and the differences across counties. And communities always ask us about that. Like, how can I determine what counties look like mine?
Yeah, with this new view, we get a better sense of the relative position of counties on the continuum of health. So under a ranking method, there might be a huge difference between a county ranked number 1 and ranked number 2, and now we'd be able to see that. It allows for more nuance in the assessment of a county's health.
And what about the color of the dots? What do they mean?
Yeah, good question. So the color of the dots represent data-informed groups of counties. So counties with similar health outcomes will be grouped in the same shade of yellow or green.
And Bethany, can you say a little bit more about the ways that people can view these similarities and differences across counties in a state?
Yeah, absolutely. So here we see a map of Michigan's health outcomes, and this is included in the Michigan State Health Snapshot. So you can see the same health outcome information from the last slides, but now in map form. This allows us to see how your county's health is meaningfully similar or different to the health of neighboring counties and counties across the state. So the color of each county on this map represents those groups that I pointed out in the dots on the last slide. And these data-informed groupings draw on health information for all US counties. In other words, on a national continuum. We recognize that health doesn't stop at state lines, right? Unlike rankings, which were confined to comparisons within a single state, we can more easily explore patterns across several states and find those peer counties anywhere in the country. So this new Sharper tool groups together counties with similar health outcomes, and we can better see ways to work together, to share resources. This aligns with our vision that all people and places have what they need to thrive.
Yeah. Thank you for walking us through those examples. What other updates can people expect with this year's release?
My colleague Molly will explain more about this in a moment, so I'll just briefly preview it now. Changes in the 2020 census data and the National Center for Health Statistics give us an opportunity to refine how we represent race and ethnicity. And so in our 2024 annual data release, we'll incorporate new categories to better align with how individuals and communities self-identify. The new categories reflect changes in census and National Center for Health Statistics data for those who identify as more than one race and to offer more specific identities. So with that, I've briefly described at a high level what you can expect from this year's annual data release, the important changes we're making, and the values and learning that guides our work. We want to work alongside everyone joining today, everyone in the field, and we invite you to join us this year in growing our understanding of how structural determinants of health, laws, policies, worldviews, shape conditions in our communities, and in turn shape health. With that, I'm going to pass it to you and Molly to dive in so that everyone can hear more about how to view and navigate our health data resources.
Yeah, thank you so much, Bethany. I know you all are excited to learn, like, what is this going to look like? How can I find data? So that's why we're bringing Molly. Molly, please, thanks for rejoining us. Now, let's start with some basic stuff because there are folks that are new to CHR on the webinar today. So can you share how we organize data for communities?
Absolutely. Thank you, Erica. So we can look at data in a couple different categories. For each county, we'll summarize demographic data to describe the makeup of a community according to characteristics like age and population size. We'll also provide data on health outcomes experienced by people currently living in that county. Think how long people live and how well they live there. This is where we're going to calculate measures such as life expectancy and mental health experience, and you might think about health outcomes as today's health. There are many factors that impact future health as well, and we've sorted these health factors into the 4 categories. The first, health behaviors, is the type of factors many people think of when they first think about what impacts future health. This includes measures such as diet and exercise and tobacco use. Next, access to affordable, timely, and quality clinical care is another important factor shaping the future health of a community. Social and economic factors include education, income, and community safety, all of which give us the type of social supports needed to enable healthy choices, afford medical care and housing, and manage stress. The physical environment is where our communities live, learn, work, and rest. We interact with our physical environment through the air we breathe, the water we drink, the houses we call home, and transportation we use to travel to work, to school, to visit friends, and to get groceries. All of these are pieces of the physical environment and can open opportunities for better health in a community.
Absolutely. And this looks familiar to a lot of you all because what you just described, Molly, what is our model of health, right?
Exactly. And when you visit our website, countyhealthrankings.org, you can explore our model to see how these factors influence community health. We have over 80 measures related to health that are updated annually. Select measures are used to calculate our health outcome and health factor summaries for each county, and additional measures can provide additional context.
Yeah, thank you for that. I'm always like surprised that we have so many measures. It's just so helpful. But can you walk us through how users can find information about health in their own county?
Of course. So I want to first mention that we will have navigational videos available online, so you absolutely do not need to remember everything I say today. And I'd like to start on our health data overview page. You can access this by selecting health data from the navigation bar at the top of any web page. As you can see here, it's circled in green. And from this page, there's 3 ways to access information. You can search by geography, county, state, or zip code, search by topic, or you can download full data sets. From our overview page, you can search directly for counties and find your county snapshot. This is the county snapshot for Genesee County in Michigan. We acknowledge that the history of a place is super relevant to current health, and we want to begin each county snapshot with a county description. The county description includes a link to identify indigenous nations native to the land, connection to large cities in the state, and a brief description of the county's connections to neighborhoods that have experienced redlining. In that same section, you can also select Show Demographic Data and see a demographic breakdown of your county.
Now, I know that Bethany previewed our new approach to viewing county health data, but let's take another look at that.
As Bethany mentioned, we're offering a sharper tool to access health of nearly every county in the country. This visual will show how the county fares relative to other counties in the state and in the nation. These data-informed comparisons focus on meaningful similarities and can help support solidarity and action to improve health. Within these graphics, we can see the state minimum and maximum in relation to the healthiest and least healthy county in the United States, the average of the state and the nation, and the placement of your chosen county. If you keep scrolling down in your county snapshot page, you'll find a table providing county, state, and national level data for each health measure. As an example, I'd like to take a closer look at the children in poverty measure. So an expandable section attached to each measure, which we call our measure drawer, is the one-stop shop for all information regarding the measure in your chosen county. At the top of this drawer, you'll see a definition of the measure, a contextual statement, and the years of data that were used for calculation. If available, the measure's data will be presented by race and ethnicity. These can help show how different racial and ethnic groups are faring within a county and can communicate inequitable experiences which might otherwise be hidden at that overall county level. Some measures will also include a downloadable interactive trend graph that shows county, state, and national data over time. In the left column of this drawer, you'll find 3 additional resources. These will link you to measure methods and limitations, evidence-based strategies that can help you address that specific measure, and a state map showing how all of the counties in your selected state compare on this measure.
Yeah, that example is so helpful because we can compare our county's health and what's like driving the length and quality of life with other counties, whether it's in the state or across the nation. I know communities are always asking about that.
Exactly. And I also want to highlight that at the bottom of both our county and state snapshots, you can find a link to our improved Compare Counties tool. And in this Compare Counties tool, you can compare up to 4 counties and include the creation of a single trend graph, which will encompass data for all 4 of those counties on a specific measure. You can also access state level snapshots, which can be accessed by searching directly for the state. And these pages will mirror your county snapshot, but include interactive maps of all counties and congressional districts in that state.
We have such good, I just have to say this. Molly, we have such great information on these county snapshots, and kudos to our data team who puts this together every year. Now, I know there's been some changes to race and ethnicity categories, so can you tell me how those will be reflected in the 2024 data release?
Yes, thank you for bringing this up. Because race and ethnicity are social constructs and they reflect societal beliefs, perceptions, and norms. It's important to remember that there is no genetic basis for racial categories. These categories and definitions have changed over time and will continue to change. Reflecting this, the 2020 census expanded the race categories from what was available in 2010 and removed archaic labels. Similarly, the National Center for Health Statistics, which is our primary source for both birth and death data, changed the way that its data were reported. This has given us the opportunity to refine how we represent race and ethnicity on our data platform. To communicate detail in our data summaries, beginning this year, we'll represent racialized groups with labels that vary by data source. This includes the addition of a 2 or more races category where applicable. And with that, I'd like to pass back to Erica. Thank you, everyone.
Thank you so much, Molly. Again, so much of what we've been talking about will be reflected in our annual data release and the National Findings Report, which, as we've mentioned, focuses on civic health. We're continuing that conversation we started last year when we explored civic infrastructure and participation. And we are looking at ways that we participate and get information to have a say in our communities. So, we're not done yet, because now we're going to talk about strategies to improve civic health. And we're going to hear next from Jillian. So thank you, Jillian, for rejoining me.
Yeah, glad to be here. Thanks for having me.
Well, can you remind us what we can find on What Works for Health?
Yes, so what works for health helps you answer the question, how can we take action to improve health? In our What Works for Health database, we've included close to 400 evidence-informed strategies, which you can find at countyhealthrankings.org/whatworks. Each of our 400 strategies offers a summary of the research and also provides examples of how it's being used. Many also include our analysis of that strategy's potential impact on equity.
Yeah, that is so helpful, that analysis where we have it available. Almost 400 strategies, folks. That's incredible. So out of those 400, what new strategies can people look forward to this year?
Yeah, this is really exciting. So we have analyzed 3 new strategies that focus on civic health because, of course, that is the focus of our National Findings Report this year. Civic health is how people participate in their communities, from local and state governance to interactions with friends or family. Our new strategies highlight 3 ways that residents can participate in their communities: public libraries, labor unions, and public deliberations. Public libraries can be important spaces for people to build community and find resources. Labor unions support worker rights and safety. And public deliberations, well, what are public deliberations? Public deliberations usually look like facilitated discussions between community members about a specific topic. The community members usually have diverse backgrounds and perspectives, and public deliberations can offer ways for people to become more informed, to
Mhm.
share their values, listen to others, and give input on decisions that affect their lives. You can also check out the strategies that we added last year that focus on civic health, and those include voter registration initiatives, voter turnout initiatives, participatory budgeting, and youth civics education.
Yeah. I can't help but give a plug for our webinars. Now, last month's webinar was about participatory budgeting. So if you want to learn more about that strategy, go to our website and take a look at that webinar. So, are there any other civic health resources that folks can find in What Works for Health, Jillian?
Yeah, so this year, along with the data release, we are offering a curated list of 45 strategies that focus on civic health. There are lots of ways that you can grow your community's civic health. You can create spaces where people can connect, learn, and act. You can improve governance and resource distribution, and you can nurture social networks and shared culture. This curated list provides evidence-informed strategies that can strengthen opportunities for people to participate in their community.
Well, thank you so much, Jillian. I know What Works for Health is one of my favorite tools. You can find so much information there. And I want to remind you all in the audience to be sure to place any questions you have in the Q&A box because we're going to start our Q&A session in just a moment. But before we wrap up, I want to share another resource on civic health. We have a new podcast series on civic health. This series focuses on the importance of supporting young people and strengthening our democracy and how building this foundation impacts everyone's health. So, we're bringing you three exciting conversations with a civic education scholar, an author, and a young community advocate. You can listen to all three episodes now wherever you listen to your podcasts. All right. I'm ending the suspense. Mark your calendars for March 20th. That's when we'll have our annual data release in a little over a week. And that's when we're going to bring you our national findings report. Again, continuing that conversation around democracy, power, and civic health. We're looking also at the information environment, including access to local news, public libraries, and broadband. All of those things are important in terms of how we are able to be informed about our communities. And we're making some really interesting connections between our civic health and thriving people in places. Don't forget, mark your calendars, March 20th. Of course, we're going to continue to bring you monthly webinars that explore the issues before us and tools to improve health and equity in your communities. And next month, I hope to see you all again because we're going to build on those conversations about civic health. And we'll have two guests that are joining us, Dr. Stella Sappho, the co founder of Civic Health Alliance, and Benita Duran, Senior Director for Equity and Civic Engagement at the National Civic League. You can register for that webinar today. And please share your thoughts about today's webinar. Colleen is sharing a link to a brief evaluation in the chat, and it'd be terrific if you can click on that link and when you see it in chat and complete the evaluation after the webinar. We do look at your feedback closely and we use it to improve our webinar. So thank you in advance for sharing your thoughts with us. Now we invite you to stay with us for our Q&A session. We will answer as many questions as we can today, but please know that we are still finalizing materials in the lead up to the release next week. And if we don't answer your questions today, be sure to reach out to us with your questions. Colleen, if you would, share how folks can reach out to us later after the webinar in the chat. And so with that, I am going to pause and invite Joanne to lift up those questions that I'm sure you have.
I'm sure there are a lot of questions, and thank you, Erica, to you and your team for presenting highlights of the updates in such a clear way. It has generated a ton of questions, and I'm grateful to Michael and Christine who are helping to answer some of those questions directly in the chat. So folks, make sure to check the Q&A box. I'm sorry, the Q&A box, because your question may have been answered by Michael or Christine there. But a few questions that we thought would be great to bring forth live. And I'm going to start with you, Bethany. And the first question is, folks want to know, will I still be able to see my county's rank?
Thanks, Joanne. So this year we're offering that new approach that allows you to see the range of health outcomes among counties in your state. You won't be able to see your county's rank since we are no longer ranking on health outcomes. Using the new approach, though, you can find counties experiencing similar opportunities and challenges both in your state and across the country. We know that healthy communities require everyone working together. And so we're hoping that this new approach inspires counties to get together to take action to improve, no matter where they fall on that continuum.
Great. And so another question for you, Bethany, and it's related to the focus on civic health with the annual data release. Can you say just a little bit more about how civic participation is tied to health?
Sure. So maybe I'll start out with a definition of civic participation for those newer to that term or concept. So that's how people engage in and create a vibrant community life. I think of this as looking like volunteering, joining a neighborhood group, or it could look like voting. Participating in our communities is tied to health because it strengthens our social connections, our sense of belonging, and that in turn can impact our physical and our mental health. So when people get involved and they're involved in shaping policies, participating in policies that can support health, they can have a say. They can have a say in how their neighborhoods look, in changing them to be safer, in changing their workplaces maybe to be safer, and supporting public health related initiatives.
That was very helpful, Bethany, and the examples were great. I'm going to turn to Molly for a second. Molly, first question for you. Folks want to know, are you adding any new measures this year?
Yeah, this is a question I wanted to address. Thank you. So we aren't adding any new measures this year. Rather than adding new measures, we really want to invite our audience to think about what societal structures are in place to influence the social determinants that we're already measuring. So think about measures of school funding adequacy, voter turnout, affordability of housing or childcare. We're really trying to think about who holds the power to shape these structures and how can you shape these structures to better support your community and have more opportunities for health?
That makes sense. All right, switching gears a little bit, but staying with you, Molly. COVID-19, we know there are lingering impacts, and folks are wondering, how is COVID-19 reflected in the data?
So some COVID-19 deaths are included in this data release. The 2024 data is going to continue deaths recorded up to the end of 2021, including deaths that are attributed to COVID-19 in that time period. That means that deaths attributed to COVID-19 in 2022 or 2023 are not included in this year's data release. The deaths that are reflected will be in our selected measure of premature death, along with 4 other additional measures of mortality. And in general, I just want to remind everyone that for each measure, you'll see the years of data used on your county snapshot. So you can always check what time period you're at.
Good, helpful reminder. All right, I'm going to switch over to you, Jillian. And folks are really excited about what works for health and the wealth of information and strategies in there. You got some love in there in the chat, so make sure you go read the chat log. But first question for you, can you say more about the strategies included in the curated list this year?
Yeah. So the strategies we included on the civic health curated list address civic health by thinking about civic infrastructure. And that civic infrastructure is the spaces or policies that facilitate connection. And civic infrastructure is really what makes civic participation even possible. So we have strategies like community centers, community gardens, and public libraries. Those are all spaces. And we also have strategies that focus more on the policy side of things. Those are things like inclusionary zoning, school finance reform, or shared use agreements. So when we thought about strategies to include on this list, we're really thinking about like, what is that civic infrastructure that makes it so folks can participate and connect with their community?
Great. You know, there's a wide range in our audience. Some folks are working at the state level, regional level, but many are working at the local level. And so I'm wondering if you can just call out what strategies can be implemented at the local level to improve civic health.
Yeah, there are lots of things that you can do at the local level to improve civic health. So thinking about spaces, one thing you can do at the local level is create or maintain spaces where people can connect. And we have strategies like community centers. We also have things like green space and parks. We have a lot of strategies that talk about spaces. You can also think about how folks can be involved in local governance through things like participatory budgeting or public deliberations. And I think a third way that folks can take action at the local level is creating programs that support growth and connection. So things like community arts programs, mentoring or leadership programs for youth, like community health workers, vocational training for adults, those are all things we have on the curated list as well. So thinking about programs, thinking about spaces, and then just working on creating ways for folks to give input on decisions that affect their lives. And those are all things that are really powerful to do at the local level.
Yeah, those are really great examples, Jillian. And just for folks in the audience, last month's webinar was on participatory budgeting, which Jillian called out, and we have had previous webinars about community health workers. So make sure you always visit those previous webinar recordings for more information. All right, Molly, you're up next. And Bethany may also want to chime in on this question, but folks want to know, will there still be access to previous years of data using the same links as they have been hosted on in the past, or will all data be rearranged to the new format?
I might ask for some clarification on the hosting of the links, but I will say that data from previous years will be available for download and complete data sets. This includes rankings from previous years are still available in those data sets as well. We haven't gone back and calculated the health outcome, health factors for previous years. I think that is the question, but I might pass off to Bethany if she's seen it a different way.
Yeah, sure. So I'll just add that folks will be able to access that previous data on the county or state snapshot just by selecting the year. So if you toggle off of 2024 to past years, you'll be able to see that data and the rank.
Great. Yeah, the way I read that question was if the same link, they wanted to know if they could use the same link as previous years. Yeah. All right, Bethany, this one's for you. Will we be able to compare our county nationally? Do you have a tool for this?
Yeah, that's a great question. So using that Compare Counties tool that Molly highlighted during her presentation, you'll be able to compare your counties to peer counties, those that have similar demographic, social, economic indicators, and you'll be able to compare to your state and national averages. So you'll be able to see that information on the snapshot, and when you navigate to the Compare Counties tool, you'll have options to see different counties, the state, and the national.
That's incredible. I think, we've talked a lot about just the data that you all providing, but the online resource itself is an incredibly powerful tool and all the ways that you can look at the data. So kudos to CHRNR for how you make the data accessible. Okay, Bethany, you did such a wonderful job of presenting the example of how the rankings are laid out a little bit differently, and provided an example from Michigan. By the way, there's somebody from Genesee County I saw in the chat who's in the audience. But folks wanted to know, just wanted to confirm if the new approach to the data applies only to Michigan, or are you doing this for every state and county?
Well, hello, fellow Michiganders. And this approach applies to Michigan and every state and county. So I lifted that up as an example, but when you go to navigate your updated data and your snapshots and use that Compare County tool this year, you'll view the health outcomes and health factors in that new way with the dots or in the shaded maps for each county and state.
Wonderful. Well, Erica, I'm not seeing any other outstanding questions. I know that Michael and Christine are still busy in the Q&A box providing direct responses, but not seeing anything for the live Q&A right now.
Okay, thank you so much. And thank you to all of our presenters and all of you who asked such great questions. I want to remind you that March 20th will be the date in which you can find all of these updates that we've been talking about. So if you go check out your snapshot today, which I encourage you to do anyway, you're not going to necessarily see the new summaries that we described to you and that we showed you because this is a preview. We're giving you a heads up. But March 20th, you will be able to get all of that information. Some of you may want to download the slides from today's presentation to kind of review what we discussed. You can do that. The slides are posted on our website at the link that Colleen can chat out, where you can get that and you can get a bio of all of the presenters. And you may have missed this, but we also record our webinars. So you will also be able to watch the webinar again. Keep in mind that we will also have that navigation tool that Molly talked about, so you'll be able to navigate the data. So anyway, just wanted to summarize all of that. Make sure you stay connected to us. I know there were some people that were new to CHRNR today. There are different ways that you can find and learn more about us. The easiest way to find more information about our new tools, new data, or anything that we may have on our website is to sign up for our newsletter. We are also have a presence on social media, and we hope that you will follow us there. So with that, um, I want to thank my colleagues, Bethany Rogerson, Molly Burdine, and Julia Giuliano for joining us today. And thank you to you all in the audience for what you do to advance equity in your communities. And we will see you next month.